Laws that penalize the use and possession of marijuana are being reformed, leading to its decriminalization or even full legalization. This trend towards legalization is truly beneficial for society. There's a tendency to underestimate or downplay the negative effects that marijuana consumption has been shown to have. For this reason, we decided to review the 4 most powerful arguments against the legalization of marijuana. First argument: its power has grown due to genetic modifications and the practice of selective breeding. They have raised the THC levels contained in the plant. The increasing potency of marijuana has led to it being considered a strong drug, capable of inducing psychosis and other mental disorders. There's clear evidence and research supporting the relationship between THC consumption and the rise in the risk of mental health issues, clarifying the importance of carefully weighing the risks and benefits before proceeding with its legalization. On the other hand, marijuana also contains CBD. This reduces the psychoactive impact of THC. Moreover, there are various studies investigating the potential of CBD as treatment for conditions such as psychosis and anxiety. But since CBD doesn't cause psychoactive effects, its proportion in the marijuana plant has been reduced by growers over the years, who at the same time have increased the concentration of THC. It has been shown that THC levels in a marijuana cigarette have increased about 4% since 1990, to over 20% in some California dispensaries by 2024. This means that smoking an entire marijuana cigarette today, it produces the same psychoactive effects as having smoked 5 marijuana cigarettes in 1990. With this, I want to clarify that the level of THC present in today's strains is not natural. Likewise, the concentration of CBD has decreased almost 5 times since 1995. Science has established a clear connection between marijuana and psychosis, a serious mental condition that distorts what you perceive as real, turning fantasy into reality. The more marijuana you consume and the stronger it is, the higher the risk of developing psychosis. However, it seems that marijuana speeds up the psychosis development process rather than causing it. That is, it makes people who are prone to develop psychosis do so more quickly, but it doesn't cause psychosis in everyone who consumes it. This is where one could argue that precisely because marijuana is illegal, more people end up with psychosis. Banning makes illegal drugs stronger and more potent. This way, the mafia can traffic more product while taking up less space, and consequently, selling each gram at a higher price. This is what happened during the alcohol prohibition in the United States of America, where strong liquor became the norm. Gin, whiskey, and tequila. These drinks might all have an alcohol concentration as high as 40%. Less concentrated alcohol like beer, which had maximum concentrations of 8%, was not available. And the same is happening now with marijuana. Imagine a world where strong liquor is the only available type of alcohol. You'd have only 2 options: get drunk every time you drink, or not drink at all. And this is what happens for most marijuana smokers today. People didn't stop drinking during Prohibition, and the numbers show that the ban won't make people stop using marijuana. We can't make marijuana go away, but we can make it safer. If marijuana were legal, there would be more options for consumers, and regulators could, for example, insist on a higher level of CBD and a lower level of THC. Just like most people don't choose to drink an entire bottle of whiskey after their workday. There are many who would prefer to enjoy an equivalent to a relaxing end-of-day beer. But from a marijuana product with low THC and high CBD, something to relax him a bit but not turn him into a couch potato zombie. Argument number 2. Marijuana is a gateway drug, and therefore if it's legalized, there will be an increase in the use of other much more dangerous drugs. I don't know, Rick. A study in 2015 found that about 45% of marijuana users consumed some type of stronger illegal drug at some point in their life. It is true that legalizing marijuana can strengthen this trend. If more young people try marijuana, they may end up using more potent drugs. But it turns out that the real gateway to drugs comes much earlier: cigarettes and alcohol. A study showed that teenagers who started smoking before the age of 15 were 80% more likely to use illegal drugs compared to those who did not. and a study from 2007 found that teenagers between 12 and 17 years old who smoke cigarettes are 3 times more likely to binge drink, 7 times more likely to use hard drugs, and also 7 times more likely to turn to marijuana. So, how would making marijuana legal reduce the use of stronger drugs? Initially, it's crucial to admit that the legality of drugs isn't the determining factor for their use. Regardless of their legal status, those interested in acquiring them, they will always find someone willing to provide them. Therefore, the essential question lies in understanding why some people form harmful relationships with drugs in the first place. There are certain circumstances that make people more susceptible to addiction, such as adverse childhood experiences, early traumas, a disadvantaged social position, depression, and even genetic inheritance. The specific choice of drug to which a person becomes addicted is often random. Individuals turn to substance use as a means of escaping their conflicts and difficulties. However, drug use does not solve these original problems, and on the contrary, ends up generating new complications. In the year 2001, facing one of the most serious drug-related challenges in Europe, Portugal took a drastic measure in the face of a desperate situation. It was decided to decriminalize the possession and use of all drugs. This meant that people would no longer be subject to arrest for these reasons. Instead, the government implemented a wide public health initiative. Those found with small amounts of drugs were directed towards support services, receiving assistance for treatment and strategies to minimize risks associated with substance use. The view on drug use transformed, considered as a chronic health issue rather than a criminal act. The effects of this approach were remarkable. The proportion of people consuming drugs and continuing their use decreased from 44% to 28% by the year 2012. Moreover, a significant reduction in the use of hard drugs was observed, as well as in the rates of HIV and hepatitis infections and overdose cases. This experience suggests that legalizing drugs could have more benefits than harms for society. The third argument against legalizing marijuana highlights its addictive potential and health hazards, suggesting that its illegality helps to minimize these harms. While marijuana dependence tends to be more psychological than physical, it still represents a serious problem. The need for marijuana addiction treatments has significantly increased, doubling in the last decade. About 10% of those who try marijuana will develop an addiction, a phenomenon linked to the increases in THC concentration. A 2017 study that analyzed the potency of marijuana sold in Dutch coffee shops over 16 years shows this trend. For every 1% increase in THC content in marijuana, 60 additional people sought treatment for health problems, related at a national level. Research has associated marijuana use with increased blood pressure and lung difficulties. Although a study conducted in 2016 stated that the use of this substance was not linked to significant physical problems. Beyond an increase in the risk of gum disease, we can put what we know into perspective. 16% of people who consume alcohol become alcoholics, and 32% of people who try cigarettes become smokers. Why do you think it will be different if you use marijuana? It's widely recognized that alcohol can have harmful effects on the brain, cause liver damage, and increase the risk of cancer. While tobacco can lead to arterial blockage, significant lung damage, and is also a known carcinogen. Annually, alcohol abuse results in the death of about 5 million people, and smoking is responsible for over 8 million deaths. Despite these well-documented risks, there is no mainstream advocating for the prohibition of tobacco or alcohol, recognizing that their legality does not imply they are safe substances. Likewise, the proposal to ban them, despite their danger, is not seriously considered. Substances such as marijuana being legal, it doesn't imply approval, but a way to regulate its use and mitigate risks, especially among the young. Argument number 4. Since the sale is illegal and in cash, no taxes are collected that benefit the country and the community from its sale. The legalization of marijuana in states like Colorado, California, and Washington has generated substantial revenue through taxes and licenses. For example, Colorado collected more than $387 million in cannabis tax and license revenues in 2020. These funds have been used in areas such as education, public health, and addiction prevention programs. Canada. Since its nationwide legalization in October 2018, Canada has seen a steady increase in tax revenue from cannabis sales. In the fiscal year 2019 to 2020, the Canadian government reported revenues of approximately 186 million Canadian dollars in specific cannabis taxes. The revenue is allocated to fund various government initiatives, including research on cannabis and its effects. Uruguay. Uruguay was the first country to legalize sales, the cultivation and consumption of recreational marijuana in 2013. Although Uruguay's approach has been less commercial and more focused on controlling the market to fight drug trafficking, it has set an important precedent for government regulation of marijuana, opening the door to potential long-term economic benefits. In addition, legalization can enable a wide range of new research to determine the true harmful impact of marijuana and who are most affected. In conclusion, marijuana is a psychoactive substance and, like any drug, has adverse effects for a significant segment of its users. It's not harmless. It seems the most effective strategy to protect society from these harmful effects. It's through its legalization and proper regulation. The comment that gets to 1,000 likes will define the next video on the channel. Remember to give a like and share if you learned something new. If you want to learn how to create content like you just saw in this video and make a living from YouTube, I'm leaving a free class in the description section and the first comment of this video. Remember, your support is very important for us to grow as a channel. You can purchase your Tuvi membership for very little money and access all the benefits we offer to our members. I truly thank you. Next, you will see 2 videos that are of interest to you. Sending you a hug. See you next time.